for our health equity team at the California Institute for Behavioral Health Solutions. I just wanted to point out that we were formerly known as the California Institute for Mental Health. So we have gone through a change to focus our intent to really address behavioral health and not just mental health, so substance use issues as well as mental health issues, and through joining with ADPI, an organization that did similar work as we did in the substance use field. So now we are the California Institute for Behavioral Health Solutions. So just for those who might be wondering who we are. And in general, we provide technical assistance in the field of behavioral health and capacity building and training to improve systems as well as agencies in terms of better outcomes for the people that we serve. In addition, on our team for this project, we have Christy Higgins, our senior associate, and the lead on the project, and we have Sharon Wright, a project coordinator, and May Chan, our project support specialist. So those of you who have worked with us before might be familiar with our staff here. Okay, so I want to tell you a little bit about the purpose of this webinar is really to tell you about this opportunity that we have with this project and be able to address any questions that people have about the project. And then so that if this seems like it's a right fit for you or something that you're interested in, then great, we've been able to make that available to you. So at CIMH, in the past, we have for several years now been doing a community-based organization capacity building project where we have been working on building the capacity of community-based organizations to really be able to be partners in the delivery of public mental health services. Our focus has been primarily on ethnic and cultural community-based organizations as a strategy for addressing disparities in outcomes and in services that ethnically and culturally diverse populations experience in California. One of the things was to help build the capacity of those organizations that are serving ethnic and cultural communities to be better able to partner with, say, the county mental health system, county behavioral health system. And so in that, so we've been doing this for several years, and in this year, we wanted to focus specifically as a continuation of our work that we did in our Building the Evidence Summit that was held in May of this year, a few months ago, is focus the capacity building on CBOs are interested in gaining assistance in advancing the community-defined practices that they've been developing or implementing or supporting. So that's the intention of this project is to do capacity building in this area of community-defined practices. So to give a little more clarity in terms of what we're looking for in this project, specifically the kind of practices that we're talking about for this project. Now the term community-defined practices can be applied for a range of different practices. So we want to, I'm not defining here what a community-defined practice is, but I'm defining what are the types of community-defined practices that we are focusing for our capacity building. What are the kinds of practices that are fit for this project? So the kinds of practices are those practices that are derived from the traditional practices of a particular racial, ethnic, and cultural community that have been determined effective by that community. So what we want to point out is these are bottom-up practices that come out of a specific cultural community based on the community's ideas of illness and healing. So they're, to use an anthropological term, it comes out of the community's worldview, or the view of how people, what is the cause of illness and what is the cause of wellness. So these are practices that are based on those cultural understandings of illness and wellness, and therefore they are targeted to members of that community. So these are, and we're specifically focusing on treatment and prevention practices, and we're focusing in the area of mental health and substance use. So there can be community-defined practices that address many other areas beyond mental health and substance use that are not necessarily treatment and prevention, and they're not necessarily bottom-up, but these are the things that we're focusing on. And to help make this clear, I'll point out the kind of practices that we're not looking for this project, for the capacity building that we'll be offering. We are not looking for practices that you might call top-down. Those are developed in an academic setting, and and ones that are based on universal principles. So we're not looking at practices that say, there's this universal principle that all human beings need to go through a process of differentiation from their parents, and so that's universal across all humanity. And so this practice is around how to support that differentiation. No, we're not looking at practices that are based on these universal principles, and nor are we looking at practices that are meant to be applied to a broad range of target populations. So we're not looking at something like, what's typically promoted in evidence-based practices are those practices that are meant to be applied to anyone or everyone, or that's the stated intent of those practices, that they're typically based on universal principles, and they typically have been researched in an academic setting. So we're specifically not looking for those kinds of practices. For this project, one of the things that we want to point out is that what we're looking for in this project is not a value judgment about other types of practices or other types of whether they be evidence-based or community-defined practices. What we're just saying is this is what we are focusing on in the technical assistance that we're going to be providing. So in addition, that means we wanted to point out that we also are not focusing on standard clinical practices that are learned by clinicians of color in a professional training program and then applied with cultural sensitivity or some cultural modification in agencies serving a range of ethnically diverse clients. So what we're trying to say here is, for this project, we're not looking at, say, for example, cognitive behavioral therapy with a modification for Pacific Islander population. That's not what we're looking for. And again, as I said, this is not a value judgment against those kinds of practices, but that's not what the purpose of this project is for. So, so hopefully that's clear. And we're also we're not focusing on outreach and engagement strategies. So when people pull together different, can look at what might be a community-defined practice, one of the things that certainly comes out is what in the past people have used as an add-on to an evidence-based practice, where they've added on an outreach and engagement strategy to an existing evidence-based practice and created a new model that merges this outreach and engagement practice to the evidence-based practice. And we're not looking for those outreach and engagement strategies. Now, one example, a simple example is, the use of ethnic and multilingual media is a very important strategy for reaching certain communities. In some communities, it's the only way of reaching and engaging them is using media other than face-to-face connections. But that in of itself is not, the use of media in of itself is not something that we're looking for in this project in terms of a practice that we're going to be giving capacity building to. And we're also not looking at practices that don't impact mental health and substance use concerns. So now we know that in multiple, many worldviews of cultures around the world, that mental health is not pulled out as a particular, may not be pulled out as a particular concern. But what we're looking for are those practices that in some way could impact or do impact mental health, even if it's not called mental health, or do impact substance use, even though they're not, it might not be called substance use in that way. So we're looking for those practices that the outcome is, that have an outcome in the mental health and substance use areas. Of course, they might address many other areas, and certainly we expect if they come out of different perspectives that don't pull out mental health, that the practice might not even be considered a mental health practice within the culture, but it does have an impact on mental health, and then that's what we're interested in. Okay, so again, just repeating, not that there's anything wrong with other types of practices in terms of these standard clinical practices that have been modified or outreach and engagement strategies. We're not saying that. We're just saying that those are not what we're going to be building capacity around. And you'll see why when you start looking at what the capacity building will entail. So I think that will be clear. Okay, so here are the objectives for this for this project, and that's to increase the capacity of community-based organizations to articulate their practice. So increase organizations their practice to potential funders and implementers. So what we're trying to do is we're not saying that communities need to articulate their practice in any particular way, but there are some who are looking for the ability to get supported by funding through different organizations, whether it be through the county behavioral health system or through foundations or other funders. And so being able to articulate your practice in a way that the funders and other implementers can get a better grasp of what the practice is and support it, that's one of our objectives, to be able to help CBOs who are interested in that, who want that. Another objective is for those CBOs who want capacity building around how to present the evidence of effectiveness for the practice to potential funders and implementers. We want to help them be able to do that. Now that might entail not only how do you articulate the evidence that you already have, but it might also involve looking at additional strategies for building evidence that can help support the funders and implementers understanding the effectiveness of the practice. And then the third objective is to help those CBOs who are interested in being able to train others to do the practice. So it can be implemented in additional communities with a similar target population. So there might be a community in a certain part of California and a similar community in another part of California, and there might be a CBO that really, really wants to help connect that practice. Certainly, for example, as an example with my colleague here with May, the Hmong community is spread out in various different parts throughout California, and there might be a practice that's very helpful or powerful that's happening in Fresno that might, or is happening even in Minnesota, that might be really good to bring to California or bring to Sacramento or somewhere else, and it might be really useful then for a CBO who's been helping to implement and develop that practice to be able to have the capacity to disseminate it through training. So those are the areas that we wanted to focus on with this project. And the idea is that this is based on what the participating agencies need or want. So you'll see when we get into the project activities how that works out. But these are the objectives. So for those organizations that have needs in any or all of these three areas, we want to be able to help them achieve these goals. Okay, so the last thing I'm going to talk about is project activities, and I'm going to turn it over to my colleague, Christy. So these are the things that we're going to be doing. So this project is it lasts for this fiscal year, which for us ends in June, or really ends in May. The project will be ending in May. So during this year, the first activity is identifying those who want to participate. So those CBOs who are interested in participating. So part of that is this introduction that we're doing, and part of it is there's an application process, so trying to identify the right fit if this project is right for your agency. And then once we have the cohort identified, the next step would be to meet with each agency in terms of assessing their capacity building goals. What specifically are your goals within the scope of this project, within those three objectives? What are your particular goals that you have, so that we can then custom tailor the capacity building that's provided in those areas. We also have to provide the technical assistance. The activities will be, once we've done this assessment, kind of develop a plan for capacity building, a webinar series of 5 webinars and also regional meetings to address cohort goals and the project objectives. So these will be tailored to what we find after the assessments in terms of what people particularly need. And then we'll do whatever seems to be areas of common need through these webinars and through the regional meetings. But if there's anything that is not of a shared or common need that's within the scope of this project, then we would be providing additional targeted training to the agency or technical assistance to the agency to help the individual agencies meet their capacity building goals. So it's through these various activities, through the joint capacity building as well as individual capacity building, that we hope that to help the agencies reach the goals that they have within the scope of this project. So with that, I'm going to turn it over to my colleague, Christy Hagen.
Okay, thank you, Will. So this is Christy Hagen, and I'm going to kind of continue on just with a bit of what Will's already introduced. So he was just beginning to talk about some of the activities associated with the project, and the very first bullet there is related to one of the benefits. So we wanted to spend at least a couple minutes telling you a little bit about what you would gain as a result of participating in the project. So the very first bullet there is related to the customized technical assistance. So once we have an opportunity to speak with you and learn some about your particular goals, and as Will described, we'll create some of the webinars and the regional meetings that focus based on a collective kind of need. But we also want to be responsive to your individual need as a CBO. So being able to work with us or the consultants that we might have supporting us in doing the customized technical assistance is a benefit. The other pro or a benefit is being able to participate in shared learning with other peers, other folks who are doing similar work across the state. And again, having opportunities, whether that's through the webinars or through the regional meetings, but really having a chance to learn and to grow and to share your experience with others across the state. And then a final benefit is being able to get some support around making a shift from service provider to practice developer and implementer and trainer. That frequently the work that may be happening in our CBOs may not spread and may not move kind of beyond our communities. And so this provides an opportunity, we hope, to make that shift from provider to practice developer, implementer, and trainer, being able to spread that, the work and the support across the state. Okay, so what are some of the examples of potential practices that you may want to think about participating in this project? So we already talked a little bit earlier about our focus really is for CBOs who have implemented and refined the following types of practices in terms of having a specific cultural tradition and targeted to a particular member of a racial, ethnic, or cultural community. And so you'll see there, and it obviously could go beyond what you see listed, but rites of passage programs, drumming, dance therapy, spirituality or faith-based, more SEO kind of focused work. Looking at healing circles or talking circles, spoken word, thinking about community healers within your particular community. So these are ideas and examples of particular practices that you may want to think about. Also thinking about things like meditation and prayer specifically related to spirituality and faith-based. Beyond kind of spoken word, thinking about the use of music, the use of shamans in terms of community healers or sweat lodges. So again, these are just a sample of things, and of course you can be thinking about your own particular practice or your CBO and the work that you're doing and how it may fit. So what we're looking for, we've been kind of mentioning this throughout the webinar so far, but some of the particular requirements is we anticipate that we can accommodate up to 20 CBOs to participate in the project, and we are having an application process, and part of the acceptance will be based upon your fit with what your goals are and needs are, and some of the things that we said that we're hoping to be able to provide. We also want to have clarity about your particular goals for capacity building and what strengths it is that you already have and that are in existence within your CBO. But also having a needs assessment and being able to understand where your areas of growth are and where you can get support related to that. We also would hope and expect that people would be participating in the 5 webinars, which we've talked about, as well as the regional trainings that we'll be offering as well. We've mentioned that there's going to be 8 of those, and again, as listed here, it's 4 meetings in a region. And then also, again, the opportunity to learn and to share with peers and kind of with a cohort of others who are building their capacity to do this work. So if you're interested, what next? You may be wondering in terms of what the application process is. And after we've had an opportunity, which we're doing today, to introduce you to the project, to answer any questions, we're going to provide you with an application and invite you to submit that by September 15th, by the end of the day, so that we have an opportunity to review applications and contact applicants by September 26th. Our team would do that. And then at that point, we'll have the opportunity to conduct our capacity building goals, strengths, and needs assessments by phone, connecting with each of the CBOs who are going to be part of the project, and then identify from there a customized kind of training plan for you and for your participation in the project. So in terms of next steps, we hope that you will submit an application, as I just mentioned, by the 15th of September. And then contact us, of course, if you have any questions. And I think at this point, unless any of my colleagues here have any additional information to add, we're going to open it up to Q&A. Let's see. Well, is there anything else? Or anything? Okay.
No, you know, we set aside an hour for this, not knowing how many, there are a lot of people registered, not knowing how many questions we would have. But really, it's just a brief presentation that we have, just to inform you about exactly what it is. And we're willing to entertain any questions that come up right now, and hope we can answer them. And then when we're done with the questions, that's it. And also, you can feel free to contact us after the webinar as well if you have questions later on.
I do see one question also. I'll read them as you have them. As Will just mentioned, please type them into the question box. And I do see one. And it's, how long does the training last? So as Will mentioned, it will occur across the fiscal year. So we anticipate the trainings will end by May. Again, we are wanting to be kind of responsive to the folks who actually apply and will be participating in terms of determining when the actual regional meetings are set and webinars. But it'll cross from, you know, October through May of next year.
Next question is, what determines whether CBO is a fit? So it's not so much that the CBO is a fit, is that the practice is a fit. So it's the criteria that we were trying to lay out before. So there might be and that the practice is a fit for this, for the capacity building that we're offering. So it might turn out that you need something else, or you're looking for something else than what we're offering. So we just want to make sure that this is right for you. So that's all we meant by fit. So the application process really is just to let us know, tell us a little bit about your practice, so that we can find out whether it is a some of those things, whether it, you know, what community is it derived from, what community is it for. Make sure it's not make sure we don't have people that are applying because they want to do like I said, cognitive behavioral therapy with a special modification for Pacific Islanders or something like that. We're just trying to make sure that these are the community-defined practices that this project is looking for. So it's not so much the CBO as it is the practice, and also whether it's an outreach and engagement strategy versus an actual treatment or prevention program that has a model. So those are the things that we'd be looking for.
Well, do you want to say more about what you mean by outreach and engagement strategies? That's a question that came up.
You know, yeah, that's a difficult one to really pinpoint. But so I think it's something. You know, all of these things, because the challenge because of how wellness and illness vary across different cultures. There's nothing that's hard and fast around this. But what about any of these things? So what we want to look at is it a practice that promotes wellness? And does it address an illness or disease? That's what we're looking for in some way. Or does it promote wellness like as a prevention program? So prevention programs promote wellness. Treatment programs address an illness. But there are other strategies that people would say, you know, this does not actually prevent anything. It doesn't promote wellness, and it doesn't treat anything. However, this is how you should interact with our community. So for our community, you should have a community event, and you should have meals. Well, the community event and the meals, that's how you engage with the community. That's how you reach out to the community. But the community meal, the way I've just expressed it, is not meant to treat anything or is not meant to prevent anything. Now, of course, like I said, this varies across different cultures. So there might be some cultures that say the best way that we promote wellness in our community is to have everyone come together for a community meal. Well, then the intention of that is not outreach and engagement. The intention of that is to promote wellness. So what we're looking at, what we're trying to get at, is this a strategy that its purpose is to just help you better communicate with the community, or is it a strategy that has some kind of wellness promoting or illness treating properties to it, based within the cultural perspective? So hopefully that helps. But it's not as clear cut because we're talking about very different approaches to healing and wellness across multiple cultures.
I see another question related to where do we access the application. So as we conclude this webinar, we will send an application. Look for an email from May Chan, and she will include it in a thank you for participating in this webinar, and then we'll provide you with access to that.
You sent it out this morning, right? You sent it out to all.
And it was included in the email you received as a reminder for today.
Participants should have already received the application, yes. So if you didn't get it, let us know. So next question, we're going to be alternating here. Who in the agency do you think is an appropriate participant? We have contracted providers who are working with these practices with our population, but they would likely not be able to participate. We may need a consultant to participate. Would that be appropriate? I think that's a great question. Who should be participating in the activities? It really is a person who knows the practice and knows the community, and then someone who can help. It might even be someone that you choose as a kind of a lead for someone who has an interest in trying to address those three objectives that we have. So of the three objectives is helping the agency articulate the practice for funders or implementers. Who's the person that might be appropriate for that, and think about that. It might not be the actual healer, or it might be. That's up to you. It might be someone who's helping administrate the program, or it might not be. It might be someone who's an assistant who helps assist the healing process. They don't have to be the lead healer. They don't even have to be the administrator. But there's someone who is part of the healing process who would like to take on this responsibility in terms of trying to either help articulate the practice more or the theory of change, or help look at how to build the evidence and then have some ability to work with, make that happen in terms of building the evidence, or someone who, again, it really depends on your objectives, because the third objective is also in dissemination training. You might have a practice that you clearly articulated. You have good evidence for community-defined evidence that comes from your community. You can articulate what the evidence of effectiveness is, but you're at a stage where you'd like to think about how to train others to do it, because a lot of people are asking you for it, and you haven't developed a training program before. So in that case, there might be the staff person who might be in charge of the training, or who might be doing the training program. So part of it depends on which of the objectives, and part of it depends on the practice itself, and then of course on your on the agency. So it's not a clear cut. We don't have a specific list of the characteristics of who needs to participate, but we'll work with you on that. If you submit an application, the person who's we ask for a contact person. So the first step is just identifying someone who wants to work with us in moving forward, who's the main contact person. That contact person might not be the lead who's working with us in the technical assistance and capacity building. We can see that as we move on. So I hope that helps.
Another question, and I think we just kind of covered it again, was the goals and objectives that will be accomplished. Somebody came on a little bit late, and yes, it was already covered. What I'll just say quickly in terms of a summary is related to what Will was just describing in terms of the kind of 3 areas of focus that we're wanting to look at. But it's basically the idea is for CIBHS to help provide TA for CBOs, community-based organizations, in obtaining assistance and advancing their community-defined practices, and really focusing on the development of the theory of change and idea model for that. Also looking at how to build evidence for supporting that practice, and then finally looking at how to become a trainer or developer in promoting that practice. So.
The PowerPoint was sent out with the reminder email this morning, so you have an opportunity to see the objectives listed in the PowerPoint. And if you didn't get that, please let us know.
Another question, what funding are you offering for this if the project is accepted? So unfortunately, we don't have funding that we are offering to the CBOs to participate, but we are hoping that the benefits of the participation in the webinars and the regional meetings and the kind of more focused technical assistance and support that's customized to you will be helpful in terms of providing you with the support that you need to then explore funding opportunities that might be available for your organization.
Next question, can we get access to the recording of this webinar? If yes, when? Yes, we'll be making this available, and we'll send the link out to everyone who's registered in case you want to be able to share this with other folks who didn't make it today. And so we'll let you know. We should have that ready within a week. So definitely should be by, let's say by the end of Friday, the end of next week, you should have gotten an email from us, and if you haven't, please contact us. And is size of the organization a determining factor? No, not really. There it's not an outright determining factor just because an organization is large that they can't participate. But certainly, if there reaches a stage where, but if there reaches a stage where we have more applicants that do have the kind of practices that we're working for, then we'll have to look more closely about how do we select which ones fit or not. So agencies that have more resources or already have the capacity to do the work on their own versus others that are need more help, we might prioritize. But right now, at this point in time, we think there'll be room for, we think we have enough room for all those who would want to participate, and size in of itself is not a criterion.
The next two are kind of related. One is, are you training CBO leadership to gather data or gathering data from promising programs to become community-defined practices? And then the other is related to, will measurement support also help in developing non-traditional clinical measures? And so, our intention is to really work with, whether it's the CBO leadership or whoever the participants are, in terms of identifying, yes, there are kind of best practices for being able to gather data to support the particular practice in order to have support for that. And then as part of that, yes, identifying how to support you if it makes sense in terms of non-traditional clinical measures, things that would be more culturally appropriate or fitting. Absolutely.
Definitely, yes. Okay, so someone asked, did I hear that applications will be provided after this webinar? Yes, they were sent before this morning to those who were registered, and if you still need one, we'll get you one. We have another question about what is evidence practice. I think that question is, I had talked about, maybe I talked about traditional evidence-based practices, and when I was talking about that, what I was talking about was those, again, those practices that have been developed typically in a university setting. They've had a lot of research. Usually they have randomized controlled trials. Although the term has been used for a whole range of practices, but typically that's what people are talking about. And usually they're talking about practices that, because it uses randomized controlled trial methodology, which tries to demonstrate that the practice works despite multiple variables, they typically have a universalist element to them, because they say, well, look, they'll typically say, well, look, it looks like race and ethnicity is not a factor for this practice, and so it can be used for everyone because we have done these randomized controlled trials and we don't see race and ethnicity as a factor. So that's what I was referring to when I used that term before. But the term evidence-based practice has been used for various. It doesn't have to be all the way there, but that's not what we're focusing on. So it's just an example of what we're not looking for. So what we're looking for are those practices that really come out of a community's cultural views and ways of healing and addressing illness, and are really targeted to that community and have not been kind of developed in a research setting, in a traditional research setting. Okay. And then next question related to that, are we targeting any special racial, ethnic, or cultural groups? No. We're really open to participants submitting their practices. So.
The next question is wondering if this is capacity building TAs only for programs in California. And yes, at this point our focus would be on California, since we're an organization that focuses on statewide efforts. So yes, it's limited to California.
Okay. Will there be suggestions, directions regarding funding opportunities? So the goal is to help you become more ready to seek funders, but the faculty that will be talking about their practices and how they've built them and how they've gotten them funded will be able to give you some ideas of who are the types of organizations that do or have been funding or have shown interest in funding or might show interest in funding. Of course, this is a developing area. The term coined through the National Network for Eliminating Disparities and Ken Martinez in California, it was brought into the the prevention and early intervention draft guidelines that were released. So that was released in 2009. In the resource manual that was attached to those draft guidelines, the director of the Office of Multicultural Services, Rachel Guerrero, had that term included in there, the definition included in there. So the history of, and then Ken Martinez was involved with a national project that was funded, which I think ended in 2011 or 2012, for looking for Latino community-defined practices. And so it's a relatively new area in terms of funding, but certainly we would want you to, we'll have our faculty share with you their experience in terms of how they've gotten these practices funded and the opportunities for funding. And certainly, of course, there's going to be there's another prevention and early intervention practice, statewide program, the California Reducing Disparities Project that the Department of Public Health, Office of Health Equity, will eventually be releasing their guidelines in terms of what the funding will be used for. So you'll certainly want to be staying tuned and paying attention to what's happening there, funding opportunities that you might have as an agency through that.
I think the last question I see is, given the practice has potential to generate income, does the CBO maintain its intellectual property copyright? And my response, and I'll let Will kind of confirm it, be that yes, yes, absolutely, the CBO would.
Oh yes, 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 yes. That's it. The idea of switching from a service provider, the mentality of a service provider, to becoming a practice developer, those are some of the questions that you'll be looking at. How do you want to control how do you want to disseminate or not disseminate, or control or not control your practice? So, you know, some people, and this is the same in the evidence-based practice world, some people copyright their materials, trademark their things, and other folks really want the practice to be widely disseminated, and they make it available widely. So that's really up to each agency, but it's nothing that in no way in your participating are you giving up your rights to us or anything like that, if that's what was the question. So.
Okay. So it is, oh, I think I see another one. I'm noticing it's almost time, but it looks like we've had another question come up. Are strategies such as promotores or peer education considered? And we kind of began to have this conversation yesterday. Well,
yeah, so so again, this is where we'll want to see your application to send us, and just to remind you what we're looking for is something that is used to promote wellness in a prevention perspective, or to actually treat an illness. We're not looking for things that are purely strategies for engaging or outreaching, but that's hard to define. So I think I just leave it up to each agency. How you talk about peer education. Oh, and let me add one more piece because of these examples. So, and the other piece is that it be derived out of a community and targeted to a community. So when you talk about something generic like peer education, that is something that could be used as a universal practice, shared universally as a kind of as a prevention strategy of educating people about healthy behaviors, and it could help. But in other instances, there are models of peer education that are very traditional, where people are coming together, and they're sitting around for a certain purpose, and in that coming together, whether it be through sewing, like in the monk community, or whether it be gardening, or whether it be platicas, or something like that, or maybe people coming together drumming, or quilting, there are these practices where people are coming together and peer education happens. So what I want to point out, it's not peer education in and of itself that would be the kind of practice that we're supporting, but it would be a practice that comes out of a community that maybe it includes peer education. So I hope that helps clarify that. And then Promotoris, of course, that's one that's been used in many different ways. Some people have even called it as an evidence-based practice, that there's some research showing effectiveness. Some people use it as just an outreach and engagement strategy. Other people use it for different purposes. So again, it gets back to the core. So I'm not going to say yes or no. It just goes back to the core. Is this something that's derived from a community, for a community, in some way has a wellness-promoting purpose or a treatment purpose? Now, I'll give you one example of how Promotoris were used in a different way. There's one practice, one evidence-based practice, that they took an existing evidence-based practice and they added Promotoris to it, and they gave that a new name and called that a new practice. So, and they said that the Promotoris were being used just to help outreach and engage the families, Latino families, to bring them into this other school-based practice that they had. So that's an example of the use of Promotoris as an outreach and engagement strategy, not as its own traditional community way of fostering healing or well-being. They were specifically intentionally using Promotoris just to engage people in another evidence-based practice, and then they created a new name for that. So it really does depend on how the practice is being used, and so hopefully that helps. And then last question. Oh, good. Thanks for the feedback. Okay, great. And then last question in terms of program faculty. Program faculty are agencies, people from community-based agencies who have had experience in developing their practices. So they have expertise in one or all of these three areas. And a specific question, so experience in kind of articulating their practice and getting it funded, convincing funders to fund their practice, have a clear model. They've trained other people to implement it in different places, or they have used culturally appropriate methods for building the evidence of that practice. So faculty will be people with expertise in those three objectives. And in terms of the cultural makeup, we will try to match as best we can, at least within the larger, as best we can within the different pool of those who are in the cohort. So we'll try to find people who have expertise within the community, but if not, so there was a question here about Native Americans. So if there's Native American practices here, we would really draw upon those who have expertise as faculty for Native American to the best of our ability to do that. So it can't be a perfect match for everyone, but we will try to be sensitive to the different cultural traditions and bring you experts that can address your cultural tradition.
And so this is Christy. It looks like maybe a final question has come up. Can a county department of mental health apply, or does it need to be a nonprofit?
So this is really for CBO capacity building. So we recommend that if there's a county who wants help in how to identify or support the community-defined practices in the community, that you contact us separately, and we'll see how we can provide support. But this is for the actual those community agencies. This is a CBO capacity building project. But we would be more than happy to work with you as a county as well in terms of what your needs might be in this area. So we encourage counties to contact us. But this is specifically a CBO capacity building project.
All right. Well, it's definitely time for us to begin to close the webinar. And a couple just quick reminders. One is that this webinar has been recorded. We will send you the link to that once it's available and up on our website. As we've already kind of said throughout this presentation and you've received emails, we will send you an email as you've already received, but that has a PowerPoint from today in addition to the application, and we encourage you, if you have questions or are interested in applying, and please doing that. May Chan, again, is the primary contact that you can expect to see correspondence from related to the project. The other thing kind of just worth mentioning is, we didn't say this earlier, but we, again, are kind of framing the project around the participants who apply and who end up participating. But we also anticipate that the webinars, we will kind of offer those to the general public and kind of do a more widespread announcement of those with the more individualized kind of TA and support for those who participate. So we hope that it'll be a help to a broader audience as well. So I think with that, we are going to go ahead and close the webinar, and want to thank you again for taking the time to be present with us and to hear about what it is that we are hoping to accomplish this upcoming year, and we look forward to hearing from you. Thank you.
Thank you all.
All righty. Bye-bye.
Bye.